Bismillahirrahmanirrahim. It's Professor Dr. Muhammad Azhar Mughal. Our today's topic is drugs used in acid peptic disease part 1. The lecture outlines are: describe basic and clinical pharmacology of various drugs used in the treatment of gastrointestinal disease. The overview of acid peptic disease. By definition, acid peptic disease is a broader term that include gastroesophageal reflux disease, peptic ulcer that comprised of gastric and duodenal ulcer, and stress-related mucosal injury. In all of these conditions, mucosal erosions or ulcerations arise when the caustic effect of the aggressive factors, that could be the acid, pepsin, bile, overwhelm the defensive factors of the GI mucosae, that is mucus and bicarbonate secretions, prostaglandins, blood flow, and the process of restitution and regeneration after cellular injury are affected. That means the nature has provided a very delicate balance between these aggressive factors and the defensive factors. If this balance is being disturbed, then the patient might develop the gastric ulceration. By definition, gastric ulceration is the discontinuity in the mucosae of the GI tract. So there is a breach in the mucosae due to these aggressive factors which harms to the mucosa, and acid or gastrin hormones, they may damages the protective mucosa. Over 90% of peptic ulcers are caused by infection with the bacterium H. pylori or Helicobacter pylori, or by use of non-steroidal anti-inflammatory drugs, that is NSAIDs. Drugs used in the treatment of acid peptic disorders may be divided into two classes, that is, agents that reduce the intragastric acidity and agents that promote mucosal defense. This diagram has been taken from Katzung Pharmacology, the textbook of the Basic and Clinical Pharmacology, 14th edition. You can concentrate in this diagram. There are two cells are clearly visible in this diagram. One is the parietal cells, which is depicted over here in orange in color. The other cells, which is appeared at the left side of the figure, that is G cells, and adjacent to it there is the D cells. And in the green color, you can see over here as a enterochromaffin like cells are this ECL cells, who basically is responsible for the secretions of the histamine. The parietal cells contains receptors for gastrin, that is CCK, cholecystokinin B, histamine H2, and acetylcholine, muscarinic M3 receptors. When acetylcholine from vagal postganglionic nerves or gastrin, that is released from the antral G cells into the blood, binds to the parietal cells receptors, they cause an increase in the cytosolic calcium, which in turn stimulates protein kinesis that stimulates acid secretion from a hydrogen potassium ATPase, the proton pump commonly named. These pumps are located on the canalicular surface of the gastric parietal cells. In close proximity to the parietal cells are gut endocrine cells called the ECL cells or enterochromaffin like cells. ECL cells also have receptors for gastrin and acetylcholine, which is depicted over here in green color, which stimulate histamine release. Histamine binds to the H2 receptors on the parietal cells, resulting in activation of adenyl cyclase, which increases intracellular cyclic adenosine monophosphate and activates protein kinesis that stimulate acid secretion by the hydrogen potassium ATPase. In humans, it is believed that the major effect of gastrin upon acid secretion is mediated indirectly through the release of histamine from the ECL cells rather than through direct parietal cell stimulation. In contrast, acetylcholine, which is a neurotransmitter that provides potent direct parietal cell stimulation. Parietal cells are stimulated to secrete the hydrogen ion by gastrin acting on the gastrin CCKB receptors, cholecystokinin B receptors. Acetylcholine has got its own receptor that is located over here as an M3 receptor, and histamine work on the H2 receptors. Acid is secreted across the parietal cell canalicular membrane by the hydrogen potassium ATPase pump into the gastric lumen. Gastrin is secreted by the antral G cells into blood vessels